Hello there. My name is Nicole. I go by Cole or Nikki. I have so many nicknames, it's not even funny. But I wanted to get on here and actually I want to start my fibromyalgia journey, which actually I started experiencing really horrible pain. I guess I've been dealing with this for about 2.5 years, 2.5, almost 3 years. All of a sudden, my body just started hurting, and it didn't matter what pain medicine I took or how much sleep I got. I wasn't getting sleep, and it was just horrible. And so, I was um, going from ER to ER, and the only thing that they would do was give me like codeine 3 and what's that other medicine? I forgot the other medicine. It's an inflammation medicine. It starts with an N. But they would give that to me, and I was popping pills like crazy because I was trying to make myself functional. I couldn't understand why it's like this side of my body hurts so bad, y'all. Like right now, my leg is hurting, but I have it kicked out. Like this side of me, that whole side of me is hurting. Don't get me wrong, my whole body has hurt before, and the longest I've had a flare was for 3 whole months where I was limping, and my daddy was like, maybe you should well, I'm not gonna say that, but anyway, he was like, maybe I should try, people who have cancer and stuff, and that's really bad, how they smoke marijuana to calm down the pain. But I'm like, that's a drug, and I can't do that, no. So anyway, I have a doctor who really doesn't believe in fibromyalgia. I don't think she really believes in fibromyalgia, and I'm like fighting with my doctor right now because she keeps running blood tests, and um the tests keep coming back normal. And she's like, well, I don't know, these tests are coming back normal, but there's not really a blood test that you can take really for fibromyalgia. The only thing they can do is rule out other stuff. And I know, and I understand it's going to take her a while to officially diagnose me with this illness. But in the meantime, I need you to treat my pain as if it's real. Don't have me sitting up here like I'm crazy or something, because I'm not. I know what I feel. It got to the point to where one time I had to use a walker just to go to the bathroom. It was ridiculous because my legs hurt me so bad that I couldn't put a lot of weight on them. It was horrible, and I live like on the third floor, so going up 2 flights of stairs every day is the biggest task. I walk around with a cane and everything. Like, me and my mom are walking around with canes, and I'm like, you're the only one that's supposed to be walking around on a cane. I'm not supposed to be walking around on a cane with you, but this is my life, and so this is what I am dealing with. So for everybody else who suffers from fibromyalgia, how did you get your doctor to like listen to you? Because she kind of makes me want to pull out my hair, because I'm like, really, I need you to pay attention. I need you to get on your job so that you can, number one, officially diagnose me, so this can be real for you, so that you can start treating me better. And let's see, I started a journal, and I know that there's a thing called living with fibromyalgia, but that's, I'm sorry, with my computer, but that's the name of my journal that I put on there. What did I write? I kind of wrote it like it was a book. But anyway, I put, the pain settled in my shoulder, making its way down the whole side of my right side. Unable to take a step without feeling the pain of this crippling disease, I pushed through it, knowing once I got home, my bed would be my best friend. All I wanted to do was work on my purse, and I'm designing, and I did just that for about 20 minutes before the exhaustion hit and I had to lay down. This life I am unfamiliar with. I used to be able to actually live, run and play with my kids without needing a break because of pain. I have become someone I don't know and have no desire to. So, it's just a little um journal that I write in every day, to not every day, but I write in it when I'm frustrated about the pain or whatever, and I try to get my frustrations out. Because I mean, this is ridiculous. People look at me and they're like, "Oh, you're fine. You look fine. There's nothing wrong with you." And I'm thinking to myself, "Okay, I may look like I'm okay on the outside, but my body is doing things to me on the inside. Y'all just don't understand, like, the things that I go through. My body hurts me so much, but yeah, I have to put on this smile and pretend like I'm normal like everybody else. And it's just, I go to sleep, it feels like I haven't slept. And sometimes I get really snappy and I have an attitude, and it really doesn't have anything to do with the people that surround me. It's the fact that I'm upset and with my body, because my body don't want to act right. And then on top of that, I have a doctor who is just like, well, this test said this, and so come back in 6 weeks. No, what's your next step? I need to know what your next step is, what the next test you're going to take. And I didn't want to have to do that to my doctor, because don't get me wrong, she's very sweet as far as her personality goes and everything, but I need you to take this seriously. I need you to keep running tests, and because keep running the tests that you need to run so that you can diagnose me. I've done all kind of research online about this disease, and the only thing that I came up with as far as the tests go are the tender points that she has yet to check. She hasn't checked any tender points on me at all. Um, And then there's a test, the FMA blood test is some new test that came out, I think, in 2013. Did it come out in 2013? That's like a genetic test. So this is what I'm going to ask her um, when I go to the doctor next week, if she can do a genetic test, which I'm quite sure she's going to say no to. And that's when I'm just going to tell her, well, what are you going to do? Because I'm your patient, and my pain is real. Although you may not think my pain is real, my pain is real, and I need you to do your job. I'm not trying to be rude. I'm not trying to be hateful. I'm not trying to be pushy. But I mean, me being nice with you is not, you're not getting it. So what y'all think I should do? I know everybody's like, get another doctor, but it's kind of hard, finding doctors. And I'm with a certain hospital's network because the insurance is off the chain. I can't find affordable insurance to be on, so I'm stuck within this network. I can't go outside of this hospital or its clinic, so I'm like stuck in this network and I can't venture out of it. And so I'm kind of, like, I don't know, I've been having this doctor for years, and she's treated me for all kind of stuff, but I'm going to need you to treat me for this and not to, act like it's nothing. She did a SED rate, my C-reactive protein, follicle stimulating hormone, and prolactin rate. She also checked my T4 and my TSH levels because I had hyperthyroidism, or I had Graves' disease for years. And so the Graves' disease that I had was pretty bad. I was put on atenolol, and basically I was taking like 16 pills a day because my thyroid levels were so high. My heart rate was beating way too fast. It threw me into hot flashes, stomach problems, anything that you can think of. I have been through it, and now my eyes are being watched for retina detachment because the doctors say that my glasses are so strong that it's causing my retinas to be pulled. And so every 6 weeks I have to go to the doctor the eye doctor so that they can check my eyes to make sure that I'm not having some type of retina detachment. And in the meantime, I'm seeing all these bright lights, not like all of the time. Like say if I sing, if I like really get into a song and I'm singing my song or whatever, I'll see like these really bright lights that just start kind of circling around my eyes. I don't know if anybody has had that. And they were like perfect, bright circles. And it would just kind of circle my eyes. It's not a circle anymore. It's like a half moon. And it just kind of goes around both of my eyes, just travels around there, and then I have like this wavy cloud over my head. It's terrible, y'all. I don't know, sometimes I think that it's a painless migraine, because I do have those too, where I get the symptoms of all the symptoms of a migraine except for the pain. So my vision can like get distorted sometimes, or I see like those clouds and stuff all of the time, and my whole body's just falling apart. So you can never judge a book by its cover. And I don't know if all of this stuff is happening to me because of the fibromyalgia. I don't know, but all I know is I went to an ER. The doctors ran tests. They couldn't find anything. They couldn't find where this pain was coming from. It was visible because I was on a cane. I was limping. It was, it was horrible. And I was like, I'm in so much pain. And she was like, well, it sounds like to me that you have fibromyalgia. You need to go to a arthritis doctor. I can't really pronounce that word. But anyway, our arthritis doctor. And so that's what I'm going to ask for, a referral to the rheumatologist, and a genetic test. And I didn't even know anything about genetic. I didn't know that genetic testing could see what best medications there are to treat you and all this other kind of stuff of whatever you're going through. What's the best medicine that your body will be able to handle? And so I'm quite sure my doctor is going to say no. So I want a referral to the rheumatologist. I hope I'm saying that right. And maybe they can order a genetic test. If not, I'll have to see where I can go. I think it's like $150 or something like that. And I'll just have to have the test done myself, because it seems like I may have to try to diagnose myself. I don't know. So if anybody has had any problems like this, or what did you do to get your doctor to listen to you, or how long did it take for them to actually diagnose you? Because I don't know from day to day how I'm gonna feel. Like, this side of me is hurting, and I've been dealing with this pain has come back. This is the third or fourth day of me being in like constant pain. And so I can't say that I'm used to it, but I just have to deal with it, and I have to live through it, and I have to fight. And and I can say those things, but I get so irritated when other people say all you need is sleep, or there's nothing wrong with you, or you don't need that cane, or you don't need to be in that little hover around cart that they have at the grocery stores. Like today I got in that, and whenever I drive in those things, people look at me and they have these looks on their faces, and I'm like, first of all, you don't know my story, so why are you looking at me like that? I know I look totally fine on the outside, but you don't know what's going on the inside of my body. I had one doctor tell me that you might have lupus. I do not have lupus, okay? Do not have lupus. And I don't have thyroid problems apparently, because my T3 and my T4 and my TSH levels were fine. And I'm so happy that I've been in remission from thyroid problems for, when did I go in remission? It's been about 3 years. I've been in remission for about 3 years. And so it seemed like when the thyroid problems are normalized, here come this giant wave of pain. And on top of that, I have stomach problems. Like when I eat, my stomach like gets angry at me for eating, and sometimes it's so bad to where it hurts to breathe. Like if I take like a deep breath, it like hurts me to breathe. And I've done research, and all of it seems to be tied up with fibromyalgia, because I was trying to see, well, maybe I damaged some nerves on the side of my body or something. I haven't had a stroke or anything, so that's not why I'm hurting. And I don't know. I don't know why all of a sudden I just have all this pain. And yeah, there go that light. It just traveled this way. I see it. It's right there. But anyway, what was I saying? Got sidetracked. All of a sudden I just start being in so much pain, just out of the blue. I just start hurting. I'm like, what is this? So I thought maybe I pulled a muscle or something, and it would go away, take some pain medicine or whatever. The first time it happened, I was in pain for 3 whole months. And it's been happening off and on. The last bad flare up I had lasted like 3 weeks. The first 2 weeks I was in the bed pretty much. I couldn't really get out of the bed because I was in so much pain from like my head to my feet. It hurt me so bad. But I have 2 kids, so I can't just sit around and lay around in the bed and all this stuff, and being a single parent, and it's hard. So y'all, I'm gonna do another video and let y'all know what that doctor says to me as an update on my test results. And although I wrote my test results down, I'm going to get on a computer and I'm going to look all that up, and I'm going to see if that's the type of things that they look for with fibromyalgia. Because although I've done a lot of research, it's ridiculous. Like I wrote, what did I write? The pain has grown worse this evening. It hurts to breathe. And then I put good night. That was in May. That it hurt me to breathe. So when it happens, I kind of take like these shallow breaths, because if I take like a deep breath, not my side, but like the top of my stomach or something, it hurts so bad. I mean, it's terrible. It feels like somebody is stabbing me each time I take like a deep breath, but it's not in my lungs. It's like the top of my stomach is where I feel this like really sharp pain. And it's just, when I try to describe this kind of stuff, my doctor, sometimes she looks like a deer in headlights. And I'm not trying to talk about her real bad, I promise I'm not, because I actually like her. I'm just frustrated with her at this point, because when you run across a doctor who don't believe in the illness that you have. And fibromyalgia, a lot of people think that crazy people have this. It's a crazy disease. You have a mental problem if you have fibromyalgia. That's not real, and this or that and the other. And fibromyalgia can just attack you at any time in your life. And so those very people who are walking around saying that can very well end up with this disease. And it's sad. It's a real sad disease, because I have read stories where these poor people who are suffering with this have accidentally overdosed and killed themselves on pain medicine, because all they wanted was for the pain to stop, and they probably forgot that they took the pain medicine and they was taking more of it, and they ended up overdosing. And so I've read a couple of stories like that, and it's very sad. And just, I have to really watch myself, and a lot of times I will suffer. Like, I just will suffer because I'm afraid for my kidneys and my liver. And I'm like, okay, I'm putting all this ibuprofen in my body. I'm putting all of this coating in my body, and it can't be good for my kidneys or my liver. And so I have to back off on it. But today I ended up taking 2 Motrins when we were out, because my legs started hurting. And although I'm still in a great deal of pain, I don't want to take anymore because of my kidneys. And so now I just have to sit here and deal with this pain. I have no choice. When you have fibromyalgia, you have no choice but to become a warrior. You don't, because I mean, what else are you going to do? Because even if you lay down and be as still as you can and not move at all, you're still going to hurt. Even if you get up and you're exercising, you're walking around and you're doing stuff, you're still going to hurt. Like today, I was active. I went out in field service today, and so I was walking. I was, you know, active this morning. When I went to that home store that used to be Garden Ridge, but now it's called Home. I went to the home store. I really wasn't that active in there because my leg was really hurting me at that point. So I got in one of the little driving carts and I drove around the store in that. But I came home and I sat down for a minute and I finished the laundry and I just got through cooking. So, it's not like I'm just sitting around and not moving, because I've read that exercise is good for you. So me and my kids went down to the office. I know I'm skipping around. I'm sorry. Me and my kids went down to the office last week and exercise. I told them, well, we're going to start out like 20 minutes because I'm hurting and I don't want to overdo it. I exercised for 5 minutes because my leg was hurting me so bad. And I was like, y'all, I can't do it. We have to walk back to the apartment. I have to walk back up 2 flights of stairs. And I can't. I'm hurting too bad. I can't do this. So I let the kids finish exercising and we came on back home. And of course, I'm where I'm always at, sitting in the bed like I am right now because I'm hurting. I have so much to do. I have so much to do. But I look around and I'm like, I can't even. This hand right here hurt me so bad. Like I could move it around today, but it hurt me so bad the other day. Um, I couldn't cut a piece of paper, y'all, with scissors. It was very painful. It hurt to write, and I'm right-handed, and it hurt me to write. It was painful for me to move it a certain way. I had it wrapped up because it was just terrible. And there was like, I didn't pull a muscle in my hand. I didn't bang my hand on something. I didn't injure myself in any way. My hand just all of a sudden started hurting. Just out of the blue, just pain, and not just a little bit of pain, but excruciating pain to where if I moved it a certain way, I hollered out because of the pain. And so it's terrible. But I know I'm rambling, but I just want y'all to know everything that I'm going through. I was getting horrible, horrible headaches to where I couldn't talk. I could whisper or whatever, and even inside of the house, I had to wear sunglasses, and it was horrible. And I was like, is this a migraine am I experiencing? Because I've had migraines. I started having migraines when I was 15 years old, but I've had them, but I haven't had them as nearly as much as I heard other people having them. My mom had them all the time. Since I've been living here, and I've been here for 4 years, I've had migraine with pain. Probably about, there go those lights again. Probably about probably about 5 times, honestly. But like right now, I'm seeing like this cloud kind of like on the edges. It's like that on the edges, and it's moving kind of like in a wavy it's moving like in a wavy thing. And I told my eye doctor that, and she was like, well, that sounds like a painless migraine. And so I actually get those about 20 to 30 times a day. I get those about 20 to 30 times a day. If I stand up too fast, everything goes completely black. I can't see at all. And then it's like this, and then I can see. That's how it is. Everything kind of opens up like a flower or something. But, I don't know if that's my blood pressure, but I don't have blood pressure issues. And I hate when things happen to you and doctors have never heard of it, so they don't know what to say to you. And they're like, the first thing that they want to do is make you seem like you're crazy because they don't understand what your body is going through. I mean, the human body is so complex, especially a woman's body. Doctors will tell you that they don't know everything there is to know about a woman's body because of the way our bodies are made. We're so complex. We're way more complex than a male body. It's terrible. But I have not tried. If you're wondering, I have not tried any of the fibromyalgia medication because I haven't been officially diagnosed. And so I haven't tried any of those. And to be honest, those side effects, losing your hair and all the other crazy things that can happen to you, I'm like, it hasn't gotten really, really super bad for me yet. And I've heard people say, well, this disease doesn't progress, and then I've seen sites that say that it does and that it can progress to where it gets worse as you age or whatever. And I figured, since you get older, you get the normal aches and pains that come along with aging. It's kind of common sense that it will get worse because you're dealing with your normal aches and pains on top of the pain that you have. So I'm telling you, this is everything that has happened to me in like life, like illness wise. I was three when I was three. Was I 3 years old? Two or something. Anyway, I was a baby. Um, I'm not a baby in diapers, but a baby. And I had the type of seizures where my fever would go up and I would just pass out. And I had that for like a year. My mom said I had that for a year. I've had pneumonia about 9 times my whole life. I'm quite sure that's probably what's going to take me out. If I live to be an old age, that's what's going to end up taking me out is pneumonia because I just, I don't know. I just had that feeling. Anyway, one time I got so sick, my mom took me to the hospital, and when the doctor looked at me, he immediately rushed me to the back. My fever was so high that they had to put me in an ice bath. I think I was 8. I remember that, y'all. That was horrible. I screamed because, putting a person in an ice bath is painful. I mean, it's not that it's just cold, it actually is painful. And so I screamed the whole time. I had cried, and I had the nurses feeling bad and everything. It was terrible. They had a tent over my head in a bed with all this steam coming in my face because I was so congested. The therapist would come and beat in my back every day. And I was so sick that when the doctors came and would take my blood, I didn't flinch. I didn't move because I couldn't feel it. I couldn't feel when they put the needle in. I just kind of laid there and was like looking at them, and I got upset. Y'all, being 8 years old, because the nurses would come in and out, and I was trying to sleep. I told one of the nurses, "Leave me alone. I'm trying to sleep," and she died off laughing. It's like, "I'm so sorry, baby, but I have to take your temperature. We have to keep on top of your temperature. We can't let your temperature go up." And the doctor told my mom that she had every right to cry because I was like knocking on death's door. Like, I was that sick. I was in the ICU. The other times I had pneumonia, it was caught early. So, it was like walking pneumonia, but it was caught early, and I was just given medication to take home. I think the last time I had it, I was 19 years old. I went to the doctor and I didn't feel good. I think I went to the ER. And that's when they told me that I had pneumonia. And so they gave me some medication for it. And, because I caught it early, it was fine. The eczema. I had eczema really bad when my thyroid was out of control, and I have noticed since my thyroid is not out of control anymore, I have not had an eczema breakout at all. So that was the thyroid making my eczema break out. Like, this hand was like completely covered. It was black. It was the color black. It was really scaly and black, and it looked like it was burnt, and it had like these little slits all in it, all these little slits in it, and it hurt so bad. I had to wrap it up because, whenever I went out, I didn't want anything in the elements to get in there, because it was like the slits were small, but it was still open. So I'm looking at a book. Tumors. I had tumors on my ovaries. I had, I think, 5 tumors, because that happened when I was in my 20s. Yeah, that happened when I was in my 20s. I had the tumors, and whenever I would lay down, I would feel stuff, and then I would get my hands and kind of move it on my stomach, and it felt like I was moving stuff around. I was like, what in the world is going on? I'm gonna go to the doctor and see. So I went to the ER, and I explained to them what was going on. They sent me to another part of the hospital. Like, immediately they sent me to another part of the hospital. They had me drink this chalky stuff that came in a cup about this tall. It was so gross. And they had me wait for like an hour after I drank that. I think I had to drink 2 of those, and they made me wait like an hour after I drank that. And after I drank that, they did a test and they saw the tumors, and then they scheduled, of course, the surgery or whatever. And when I went in, they ended up, they said that they were um, benign tumors, and one was a dematoid tumor, which was a cancerous causing tumor. They took them all out, and they accidentally took out my good ovary, and they left the bad one in there, the one that had the cancerous cell hooked to it. They said that they scraped as much off as they could, when I specifically told them, do not take my organs. They took it anyway. And so I'd rather for them to have taken the bad one and leave me with the good one, but no, they took the good one and left me with the bad one. So figures. But I think it's pretty much, oh, psoriasis. I had psoriasis like horribly as a child, though. It was bad. It was really bad. So I am no stranger to illness. I'm no stranger to hospitals. I'm no strangers to doctors or any of that kind of stuff, because I've dealt with a lot. And now I'm dealing with the fibromyalgia and everything that comes with it. So I don't know, you guys. I have another doctor's appointment because I'm worried about something, but I'm not going to put that out there. I'm just not. And so hopefully when I go to the doctor, I'll get a clean bill of health in that area that I'm concerned about. So, but yeah, that's pretty much everything. So you can kind of get like a whole idea of my illness story. That's what I should have named it. But anyway, I just want to know, like, how did you get your doctor to listen to you? How did you get your doctor to be like, okay, you have this, or okay, this is what we're gonna do. Step 1, 2, 3, 4. I'm a step 1, 2, 3, 4 type of person, and my doctor's like Z, A, H, J, R type of. No, I need you to be an A, B, C, D person, or 1, 2, 3, 4 person, not a 6, 1, 10, 55, 100 type person. No, you're scattered all over the place, and I need you to pull it in together tightly. But yes, that is what I'm dealing with. But yeah, that's everything. And I would, I got this book already. This entry was called The Great Escape. And I'm going to say this and then I'm going to quit because it's like 34 minutes. I've been just running my mouth. I said, the sky lit up like flashlights peeping through the clouds. As I open my eyes, holding on to the warmth of my blanket, I feel a slight headache. No pain on my right side. This is great. I got up and got dressed, to take my daughter to class. The pain slowly starts to attack me once again. All of a sudden, I feel very nauseated. Still determined to make my great escape from my bed, I continue to get ready. The pain and the nausea gets worse. My attempt to escape has failed. My father has to sign her in. I took my meds, ate, and lay down. I will be lying. I would be lying if I said I didn't. It didn't bring me down a bit. A tear made its way out my eye, but I didn't allow the rest to come. Yes, I feel defeated today, but I have hope, and that keeps me moving. So that particular day, I had planned my great escape from my bed, and I failed miserably, but I made it out of it today, so I'm happy about that. And I have some good footage of us playing around at the store, even though I was in my little store hover around, and I have no problems with getting in that at all. If I'm hurting, then I'm gonna get in it. But anyway, I have talked too much, so yes, please leave a comment below, my fellow fibromyalgia sufferers, and or I should say warriors, I'm sorry, my fellow fibromyalgia warriors. Please leave a comment below and just let me know, how you dealt with your doctor. And please, no nasty comments, because it's really not necessary. This is a more of a please help me type of video, and I just wanted to tell my fibromyalgia journey story, the beginning of it. And like I said, I will let you guys know what the doctor say. Okay, bye.